And with us on the telephone today, socially distancing, as we've been doing for the last several weeks, we have Imperial County Chief Executive Officer Tony Rouhotas, Imperial County Public Health Director Jeanette Angulo, Jeff Lamoure, Deputy Director, Environmental Health, and Chris Herring, who is the County EMS Coordinator. I think I got all of that right, didn't I?
Sounded great.
Okay. Lots of things happening right now in the Imperial Valley related to the COVID-19 pandemic. Let's, if it's okay, let's start with Chris Herring. Chris, you gave a great update the other day about the situation with the hospitals, with the influx of patients, the overflow, and everything else. Let's go back and recap some of that. What was it, Tuesday, Monday night? Just the local hospitals were swamped?
Yeah, so between Monday and Tuesday, we did see that surge of patients coming into our local hospitals. It was about a 27% increase from the day before. So we were notified early Tuesday morning of the situation, and we quickly kind of started mobilizing forces and mobilizing some of these response plans that we've been working and training on for years. So what we did was we reached out to the California EMS Authority, and they actually deployed an ambulance strike team to Imperial County. They were on site within a couple of hours. And we were able to start offloading and decompressing the two hospitals relatively quickly to, start decompressing these patients and moving them to other hospitals throughout the Southern California region. So that process, started actually Tuesday afternoon, and by Wednesday we had transported more than 40 patients to regional hospitals. Which really did take a burden off of our two local hospitals, and they've been able to kind of stabilize themselves over the last couple of days, and we're working with additional state and federal resources to help shore up and boost up the staffing in those facilities to be able to handle that increased load as we continue through this week.
Okay, and I've noticed I'm on the flight path to El Centro Regional. Transfers are still going on by helicopter, and I'm assuming by ground transport as well.
That's correct. So the transports do continue. It is a mixture of air ambulances, helicopters, and the ground ambulances, both from this ambulance strike team that the state has deployed to us, as well as our local EMS system resources.
Okay, and the mutual aid plan has been in place, I know, for years. We see it on a regular basis with fire personnel, and it's also in place, obviously, for the medical emergencies.
That is correct, and I think it goes to show how strong California's mutual aid system is altogether. From the fire side to the medical and health side, law enforcement, these parallel systems all integrate with each other, and we do have strong support from our regional and state partners throughout this effort.
Okay, now my understanding also is they are setting up a mobile hospital. It may even be happening as we speak at Imperial Valley College.
So what it is, it's called a federal medical station. So it's going to be a location where low acuity, so the less sick, so to speak, patients can be transported to there to take some of that additional burden off of the hospitals. It is important to note, though, that it does have to be a patient that's transferred from one of our two local hospitals. It's not going to be kind of open to walk-in patients. Or 911 call ambulances aren't going to be transporting patients to there. Everybody should still go to the closest hospital that they are to seek medical care. And if they are COVID positive or ill enough where they need to be hospitalized, they'll be hospitalized. If they're unable to return home, that they could potentially be transferred to this federal medical station to continue care.
Okay, and one of the things I know that Pioneers and El Centro Regional have both stressed is they are open and they are functioning for the Imperial Valley.
That's correct, and so I know one of the things that got said on Tuesday, and I think that caused some confusion within the community, is the diversion. Diversion is a common practice. I know we've gone through this several times. So diversion itself is common. It happens not just during COVID or times of emergencies. It's a method that our hospitals can use to help take some pressure off of their system. We see it frequently during the off-road season when we have that impact from the off-roaders that are injuring themselves and being taken to the hospitals. What it does is it in a sense it just diverts ambulances from one hospital to another. It's not the closure of an emergency room. It's not the closure of a hospital. It's just a way to help better distribute patients so the hospitals can manage the load better. So that did occur on Tuesday. The hospitals were diverting patients, and essentially they divert patients to each other. So if a hospital's on diversion, we're still, our 911 transports, our 911 ambulance transports aren't going to be transported out of the county. They're going to be transported to the closest hospital still, especially if they're both on diversion. Okay.
Now, let's talk about personnel. And it's a rather unique situation in that the hospitals with the COVID-19 patients stressed there, but in other areas of the hospital, things are slow. People, there's been no elective surgeries, and people are getting sent home. It's been an issue with personnel. Okay, the hospital that's going to be at IVC, and some backup help for the local healthcare providers. Is that coming?
Yeah, so we do have, and actually they hit the ground yesterday, and my understanding is they already started working shifts. And it's a variety of sources of staffing assistance that's coming into our healthcare system. Yesterday we did have it's a federal health and human services strike team is what they're calling it. It's part of the National Disaster Medical System. And it's a team of critical care nurses, a couple of physicians, and some technical staff, respiratory therapists. They actually started working yesterday. We're also anticipating a very similar makeup of staff from the California National Guard to be on the ground and working here shortly as well. The other piece that our hospitals are starting to utilize, it's called the California Health Corps. If you're familiar with Governor Newsom's initiative, this was an initiative to onboard healthcare workers, nurses, physicians, mid-levels, like physicians assistants, nurse practitioners, to be able to deploy them throughout the state and kind of insert them where they're most needed. So both of our hospitals are working through that program as well.
Okay. And Chris, I appreciate the information. It's very helpful. And again, you've stressed the fact the hospitals are open, they are functioning, and that has not been an issue, though some people may have misunderstood that. But let's talk about testing. And Jeanette, is that in your area there?
It is, but it's also in Jeff Lamoure's area, since he's been coordinating the community testing site, OptumServe, so he can talk a little bit more about that.
Well, the only reason Jeff came back this week is he wanted more of my coffee.
That's exactly what I was after.
Okay. Well, okay. Jeff, you're on. You're on, Jeff. Go ahead.
Okay. With OptumServe is still operating currently at the Imperial County Fairgrounds. It is set up. It's by appointment only. We are at capacity with that testing, which is great. We are booking the 132 slots per day. So that is fantastic. My understanding, talking to OptumServe this morning, we are appointment-wise, we're about 7 days out with appointments. So that's with that on Tuesday, I submitted a request to the state to request either a second lane, which is an additional 132 specimen collections at the existing site, or a second testing site. So that is currently being evaluated, and I hope to have an answer hopefully by the end of the day, since it was requested on Tuesday. In addition to the request to expand the operation there at OptumServe, I've also requested to move OptumServe to a new location. So we will be moving. We'll be moving June 1st to the Kxo Community Center on Dole Avenue or Dole Street. But those who currently have their appointments, the way that they through the 31st, I have my days right in the month, through the 31st, they will continue to go to the Imperial Fairgrounds for their appointment. But after that, during that weekend, we'll be moving the testing center over the weekend to Kxo to have it up and operating on June 1st, Monday morning. So that is kind of where we're at with that right now. So it is moving along.
Okay.
Carroll, I want to add that individuals are encouraged to to make an appointment, those that have symptoms and those that don't have symptoms. So with or without symptoms, feel free to make an appointment. They can call 888-634-1123, or they can register via online at lhi.care/COVID testing.
In addition to that, we have a number of healthcare providers that are providing testing. So I would, if the public wishes to be tested, we would encourage people to go out and get tested, to reach out to their healthcare provider to find the nearest location or whatever they're referred to be tested. With that, collectively, we can have a better understanding of what's happening in our community. So we really encourage the community to go out and get tested.
Okay, we're at the point now. I know initially it was basically if you are displaying symptoms, you'll get tested. But now anybody can get tested. And through OptumServe, there's no charge. You do make the appointment and get tested, and then you get the results back in about 48 to 72 hours, right?
That is more or less. That is correct. That is correct. Obviously, at OptumServe, there is not a cost, so to speak, for the testing. If you have insurance, they will request that information. If you don't, that is fine, and they will move forward with doing the testing regardless. There is no out-of-pocket collection or fee there at the location or at the testing site. There are other practitioners or healthcare providers that are providing, and there may be a fee associated with their testing, which is fine. Just for the public, when they are looking for a testing location, they want to ask that question.
Okay, and the test itself is what, a nasal swab, which is basically painless.
It is a nasal swab. That is correct.
Okay, so Tony.
Yes, sir.
What is happening county-wide? What, we've been talking the health department and the issues there. What about the rest of the county?
So I know that EOC this morning or beginning yesterday was coordinating with Chris Herring to make sure that we have all of our side of the resources taken care of to help facilitate the needs of the field medical station. There's a lot of logistical things that need to be helped set up along with IVC, the coordination of security, utilities, just some of the logistical stuff that they'll need, oxygen, sanitation, the things that help run the backside of the hospital. So that's been keeping everybody busy. Of course, a lot of messaging going out. There was a great press conference. The team did a really good job of setting that up with the two hospitals with Dr. Edwards and Larry Lewis yesterday. Both came in and participated with Jeanette and the chairman. There was a great presentation put together, and the team did a great job doing that. We're doing some messaging to go out today to remind everybody as well about Memorial Day weekend in large groups. We know it's usually the unofficial beginning of summer, and a lot of people tend to like to go out and have large gatherings or travel, and we're really reaching out and saying, hey, hold off a little bit. let's move forward with some of those large group gatherings. Let's limit our travel just to essential travel only, because we do need to still maintain our numbers as we're moving forward.
And I think part of what we've seen this week has been residual from Mother's Day. So we don't want that second surge following Memorial Day weekend.
And you are correct. We saw that with Easter weekend, then with Mother's Day weekend, and we just hope that it doesn't happen again with Memorial weekend. Yes.
Well,
we don't want the spikes.
And, I know Dr. Monday stressed, okay, we are hopefully moving forward, but the stay-at-home orders and the facial covering orders still hold. So make sure you do that.
That is correct. As I've said it before, Carroll, we can't let our guard down. I know we're a little tired. It's been many, many weeks. But we need to take responsibility and do our part. So face coverings when we can't meet that 6 feet distance from others that are not in our household is very, very important. Cleaning, disinfecting, washing hands with soap and water, those hygiene practices also very, very important.
Okay. Did we miss anything?
Hey, Carroll, this is Chris Herring. I just wanted to take a quick minute and talk about our EMS providers that are out working in the field. It is National Emergency Medical Services Week this week. I think for us, we're used to this week being full of some EMS barbecues, just like we would be doing for Memorial Day. I think this year is a little different for everybody, but I think it truly, it shows what our EMS system is capable of doing. There's a lot of hardworking and dedicated men and women that are out working on fire engines and working on ambulances during this response. We're all a couple months into this, and I think we can see it in their faces. They're tired, but they're not slowing down. They're pushing forward. So we just want to say thank you to all of those providers, and tell the community, if you see them, tell them thank you as well.
Well, these are the very first responders, be it an accident, be it a 911 call. The fire department and the ambulance crews are typically the first on the scene. And as you said, yes, having been around several of them, yeah, you can see some strain there, but no, they haven't slowed down. So we do salute them. And is that it?
Unless you have anything else, Carroll, I just really want to emphasize, let's limit our large group gatherings. Let's be consistent with our actions, be responsible, and help us help you guys.
Okay. To all of you, enjoy the weekend as best you can.
Thank you, sir.
Thank you.
Thank you. Thank you.
The Imperial Valley's best oldies on the radio.
The best music all day.
Hey, what's up, man? What's going on? Hey, let me call you back, man.
Hey man, how's it going?
Hi, so I have this stain and I heard you're the guy.
Say no more. Valley Dry Cleaning's got you covered. There you go, man.
Cool, man. Hey, man, you got it out. What'd you guys do?
Let's just say we've got a secret weapon.
Thanks, man.